Have you ever woken up in the middle of the night with a strange sensation in your feet, an insatiable thirst, or a sudden craving to eat? What if I told you that these could be signs of diabetes? That's right. Many people ignore these nighttime symptoms, but they can be a big warning that something's not right. Today, we're going to talk about 5 nighttime diabetes symptoms you should never ignore. I'm Dr. Vitality, a specialist in nutrition, weight loss, and healthy aging, and I'm here to help you understand these signs better. Stay tuned because your health might depend on it. Have you ever felt that annoying tingling or numbness in your feet and hands at night? It's like your limbs decided to take a nap at the wrong time, right? Well, this can be a sign of diabetic neuropathy, a common complication of diabetes, and it's important to pay attention to it. Diabetic neuropathy occurs when high blood sugar levels damage the nerves in the body, especially in the extremities like your feet and hands. This causes that tingling or numbness sensation that can be quite bothersome at night and even disrupt your sleep. Studies show that about 50% of people with diabetes develop some form of neuropathy over their lifetime. But why does this happen? When blood sugar is elevated for a long time, it can damage the nerves because excess glucose interferes with the nerve's ability to transmit signals. Additionally, diabetes can cause problems in the small blood vessels that nourish the nerves, reducing blood flow and leading to neuropathy. And don't think it's just a minor inconvenience. This tingling and numbness can progress to severe pain and even loss of sensation, increasing the risk of injuries and infections, especially in the feet. Imagine stepping on something sharp and not feeling it. That's where the real danger lies. To manage these symptoms, it's essential to keep your blood sugar levels under control. A balanced diet and regular physical activity are fundamental. There are also medications and therapies that can help alleviate symptoms and improve quality of life. If you're experiencing these symptoms, it's time to talk to your doctor and discuss the best treatment options. Do you wake up in the middle of the night with your mouth as dry as the Sahara Desert and a thirst that seems impossible to quench? It might sound like an exaggeration, but this is a common symptom for those with diabetes. And this intense nighttime thirst has a very interesting and important explanation. When blood sugar levels are high, the kidneys work overtime to filter and eliminate the excess glucose through urine. This process ends up drawing a lot of water out of your body, leaving you dehydrated and with that unquenchable thirst. It's like your body is saying, "Hey, I need water to deal with this mess." Besides being an annoyance, excessive thirst can disrupt your sleep since you need to get up multiple times to drink water. And it doesn't stop there. Drinking a lot of water at night leads to more bathroom trips, and your sleep gets more and more fragmented. This vicious cycle can leave you exhausted during the day, affecting your energy and productivity. To manage nighttime thirst, the first thing to do is to keep your blood sugar levels under control. A balanced diet with low amounts of sugar and refined carbs helps a lot. Also, drink water regularly throughout the day to keep your body well hydrated and reduce intense nighttime thirst. And here's another tip. Avoid drinking large amounts of water right before bed. Try to distribute your liquid intake throughout the day so as not to overload your body at night. Have you ever found yourself opening the fridge in the middle of the night with a hunger like a lion, even after a hearty dinner? It might seem strange, but this unexplained nighttime hunger can be a symptom of diabetes that deserves attention. Nighttime hunger, or nocturnal eating syndrome. Yes, it has a technical name. Happens because blood glucose levels are out of control. When glucose is not adequately used by the body's cells due to a lack of insulin or insulin resistance, your body sends hunger signals, even if you've already eaten. It's basically begging for energy. This creates a complicated cycle. You eat more, especially carbohydrates, which further increase blood sugar levels. And then, guess what? More hunger later. Besides disrupting your sleep, this cycle can make weight control and diabetes management more difficult, leading to more serious complications. So, what can you do to control this nighttime hunger? First, it's essential to maintain a balanced diet throughout the day, rich in fibers, proteins, and healthy fats. These nutrients help keep blood glucose levels stable and provide a longer-lasting feeling of fullness. Avoid high glycemic foods like sweets and white bread, which can cause glucose spikes followed by crashes. Another important tip is to avoid large meals close to bedtime. Opt for lighter, balanced dinners. If hunger strikes hard at night, choose healthy, low-glycemic snacks like nuts or plain yogurt, which won't spike your blood glucose levels. Maintaining a regular exercise routine is also fundamental. Physical activity helps improve insulin sensitivity and control blood sugar levels, as well as helping to regulate appetite. Who hasn't gotten up in the middle of the night to go to the bathroom, right? But if this is happening to you several times a night, it could be a sign of diabetes that needs attention. This symptom, called nocturia, is quite common in people with diabetes. When blood sugar levels are high, the body tries to get rid of the excess glucose through urine. The kidneys go into overdrive, filtering more blood and producing more urine. The result? You end up needing to go to the bathroom several times during the night. This not only disrupts your sleep, but can also lead to dehydration if you don't rehydrate properly. This frequent urination is more than just an inconvenience. It can affect your quality of life, leaving you tired during the day from not getting enough sleep. And constant fatigue can affect your productivity and mood, creating a tough cycle to break. To deal with nocturia, the first step is to control your blood sugar levels. A balanced diet, regular exercise, and if necessary, proper medication are essential. Also, avoid consuming large amounts of liquids, especially caffeine and alcohol, in the hours leading up to sleep. Keeping a urinary diary can help. Note how many times you get up to urinate and discuss this data with your doctor. This can provide valuable insights into the severity of the problem and help adjust your treatment. Have you ever woken up in the middle of the night drenched in sweat, like you've run a marathon while sleeping? If this happens frequently, it might be more than just being too warm. Night sweats can be a symptom of diabetes. Night sweats in diabetics are usually related to low blood sugar levels, or hypoglycemia. When blood glucose levels drop drastically during the night, the body goes into emergency mode and releases hormones to try to increase blood sugar. One of these hormones is adrenaline, which can make you sweat like you're running from a lion. Additionally, diabetes can affect the body's thermal regulation, causing you to sweat more at night. So, what can you do to avoid waking up drenched? First, regularly monitor your blood sugar levels, especially before bedtime. If you take insulin or other diabetes medications, make sure the dosage is correct. Talk to your doctor about necessary adjustments to avoid nighttime hypoglycemia. And don't forget to maintain a proper sleep environment. Wear light clothes and keep your bedroom well ventilated. A fan or air conditioning can help regulate temperature and reduce sweating. If you enjoyed this video, like and subscribe to the channel for more important health and wellness tips. And for those who want to take their health to the next level, check out the smoothie diet. Delicious, easy-to-make smoothies that promote quick weight loss, increased energy, and incredible health. Click the link in the first pinned comment to learn more. I'll leave a recommended video for you to watch as well, which provides valuable information to complement what we discussed today. I'm Dr. Vitality, and remember, health comes first.